Canada's epidemiologist Raywat Deonandan. Raywat, first of all, the cases that are soaring in Ontario and Quebec. Tell us about that.
Well, it's the same old story, but the test positivity rate amongst children is up. It's the highest it's been throughout the pandemic, I think, which suggests that transmission is increased amongst young people. Now, this could be due to a number of factors. It seems likely it's due to socialization that occurred over the holidays. Yes, schools were closed, but kids were going to family gatherings and other kinds of social events. And it might be due to the new variant having arrived as well. We have no evidence of that. I'm just speculating, because there is some evidence that the new variant finds purchase amongst young people a little easier.
And the fear there is that the young people get it, give it to the older ones, and boom, you're into real trouble with the number of cases leading to number of hospitalizations and, dare I say, deaths.
Absolutely right. That is the case. And we've been saying this for months now, but I guess some people still need to hear it. Just because you personally, a young, strong person, have a low probability of anything bad happening to you, there is a fairly good probability you will be part of a transmission chain that leads to somebody else's death. This is the nature of population health. This is not about individual risk. It's population risk. And unfortunately, everybody has a role to play in that endeavor.
Now, Ontario at this point ruling out a similar curfew that Quebec has introduced. Do curfews work? Have they worked elsewhere? Can we hope that those case numbers get down in Quebec as a result?
It's a good question. Some studies show that they do work in places like Spain and Italy, and some studies show that they possibly don't work in places like France. It's hard to say. They only work if they succeed in changing human behavior. All of these policy levers, whether they're economic restrictions, closing schools, whatever, are just meant to compel people to behave a certain way. But I hear stories of the curfews in Quebec leading to people staying home and having parties at home because they're stuck at home. If that's what it leads to, then the disincentive for minimizing your individual exposures has failed. Personally, I think we should look at the bigger bang for your buck targets before we get to curfews. For example, I think schools should be closed longer. They're a better source of transmission. And then if that doesn't work, then we pull out all the plugs, including curfews.
Numbers a little bit better here in Manitoba, but they're still saying a whopping number of cases linked to holiday gatherings, and almost, I think the number today was about 3,000 contacts of those holiday gathering cases. Interesting to note, and I know obviously as an epidemiologist you're a numbers guy, at Canada.ca, which is a federal government website, it is now listing as of January 7th the vaccine distribution of the Pfizer and Moderna one for the country, which is just under 550,000. And then by each province. So according to this chart, as of January 7th, Manitoba has received just shy of 26,000 doses, and we've just passed the 10,000 administered shots. When you look at the rollout and the numbers and how much supposedly is in the country and in the hands of the provinces, is it taking too long? Should we be more patient? Because I sense there is growing frustration at the pace at which this is happening.
I'm of two minds on this. On the one hand, I'm definitely frustrated. This should be priority number one for the entire civilization to get the vaccines out as quickly as possible. And places like Israel have certainly taken up that challenge and are putting us to shame. On the other hand, I recognize that there are some administrative roadblocks and a bit of a learning curve. So I'm willing to give, our leaders a few weeks to figure this out. But once we get sufficient supply, I expect to see this being the single biggest priority of our nation. It's our best bet to normality. Now, the numbers are a bit confusing. I'm unclear as to whether they're referring to all of the available doses or just the doses reserved for the first shot and not counting the other half that we're keeping in reserve for the second shot. Different provinces are approaching that differently. But it seems that we're going to look at this enormous explosion of manufacturing in the next few months, in which case supply should not be an issue in the long run. We should be able to, therefore, lubricate a much better distribution system. This is the challenge that I hope our leaders are up to.
We know that Deloitte has now received a federal government contract to build a computer system to keep track of the rollout. Clearly, the feds want some transparency by putting the numbers on the website so it can say, look, we're shipping it out to the provinces. When you look at the rollout and what is expected, and as you say, that supply should soon not be the issue, we've heard end of June as an optimistic target, end of September. The other target by federal government officials, do you buy either one of those as when we could all have a needle in our arm?
I think September sounds reasonable. However, there's nothing preventing us from keeping our leaders' feet to the fire and demanding earlier. I think July is not unforeseeable. I think March is not unforeseeable if you really pull out all the stops rather. So, and I'm glad to hear that they're investing in getting an external supplier for a computerized system, but I hope that doesn't fall into the standard governmental boondoggle of taking much too long and being far too complicated than it needs to be, because managing the data is critical to all of this. I don't want to be overly critical, but I think it's important to be critical in order to keep our leaders accountable and to convince them of the urgency of this in case they've forgotten that vaccination is our best bet to normality given the lack of compliance across the board to public health guidance. So this should be a singular focus for our leadership for the next few months.
Raywat, we appreciate your time. Thanks again for joining us this afternoon.
Thank you.
Raywat Deonandan joining us live on 680 CJOB from the University of Ottawa.